Welcome to Citizen Impact. I'm your host, Logan Martinez. Citizen Impact's a project of the Miami Valley Full Employment Council, activist group here working with low-income and unemployed people for the last 25 years now. We have a very exciting show. We're dealing with a health care crisis, the Affordable Health Care Act, and have several doctors and activists who are working on the health care issue here in Ohio. We've been very active this last year. We just had a demonstration on International Women's Day with the Community Action Partnership, about 40 people demanding jobs and opposed to the automatic cuts. People are being cut off, programs are being tapered back all across the country. Everything from the WIC program that provides food to pregnant women and their children, to housing, to you name it. Here in Dayton at the base, people are losing their pay. Whether that's going to go into effect, last time I saw was up in the air again, but they've cut back on services and stuff out there. And the automatic cuts are designed to peel off trillions of dollars over the next 10 years. It's estimated that nearly 2 million jobs may be lost, either directly or indirectly, because of these cuts. And as you well aware, we still have 5 years into the Great Recession, tremendous amount of unemployment. Nationwide, the official unemployment is around 12 million people. Real unemployment is we estimate to be around 23 million unemployed people who would be in the workforce, who are no longer working. They are part of the hidden unemployed, which is an official figure that's given out by the Labor Department, and part of there's 7 million people who are working less than 14 hours a week trying to make a living. And we include them, the underemployed. And so we still have a tremendous amount of unemployment. There's been 20,000 home foreclosures in Montgomery County over the last 4 years. We have all kinds of boarded up houses in the city of Dayton. There's a big effort to tear down these houses as a solution and to create green spaces. But there aren't the jobs to have people working in the city. It really adversely affects the people in our town, and we are going to be doing some things. We're working on the expansion of Medicare, which we will be talking about, Medicaid, excuse me. And we're going to have a demonstration, I think, on June the 22nd. You're probably wondering why I say we think we're still negotiating exactly, but sometime in the very near future, we're going to be having a demonstration against the cuts and for jobs and for the expansion of Medicaid and health care for all. We have very exciting guests here tonight, and I really appreciate you guys coming. We have Bill Davis, which is with SPAM Ohio, the regional coordinator here. You've been doing this now for a couple years.
Since 2005.
Dr. MJ, I want to say your last name, Matthew, but it's you want to say it for me here?
Sure. It's Noordsij-Jones, but everybody calls me NJ. That's a lot easier.
All right. Well, I'll call you Matthew and
Sounds
the doctor
good.
from time to time. And Kathy Lambers? Lambus. Mm-hmm. I'm very bad at names. I apologize. Who's also a practicing doctor here in the Dayton area and from the Dayton area.
Yes.
I appreciate you guys being here. And
Our pleasure.
not only are practicing doctors, you're concerned about how health care is paid for and how it's provided here, and you're involved in trying to promote the single payer solution and trying to get better health care for people. So we really appreciate what you've taken the time to be here tonight and your efforts to improve the health care of Americans. We've been involved. This health care crisis has been going on and on. As I was talking to you earlier, our original TV show 25 years ago dealt with the health care crisis. There was a rally in Columbus, about 1,000 people in the State House. It was very impressive. And we thought, well, it was going to take a few years, and that was in favor of what the single-payer solution, in which we'll explain in a minute what that is. At that time, I think there was like 39, 38 million people that were uninsured. Now we have 50 million Americans that are uninsured. As I was saying earlier, when I was young, the doctor would come and visit me in my home. Today, you go to the hospital and you don't see your family doctor at all. You see the hospital doctor. And I've heard one story after another of the red tape and miscommunications and problems that people have because of it's been one layer on top of another layer of healthcare bureaucracy, and it's expensive as heck. There's the co-payments that people have to pay are hundreds and sometimes thousands of dollars. We have people, they estimated one of the studies that they did is that 2 people die prematurely each day in the state of Ohio because they don't have health care for one form or another. That's an old study. I don't know how accurate it is today, but we know people die prematurely because they don't have health insurance.
And I think nationwide that's about 45,000.
There was a study done by at Harvard that said exactly that. There was in the low 40,000s that die every year nationwide because of lack of
I think it's from that study that they said, well, given our percentage of the population, and you run into all kinds of people that are trying to struggle through this and are dealing with it, and yet we have now the Affordable Health Care Act, which I think for most of our point of view is a step forward, but a very weak step forward. It doesn't cover everybody, and it leaves a lot of people out still. And it's real questionable how it's going to be implemented. It's still up in the air. So why don't you start telling us a little bit how you see it and your feelings about the healthcare crisis as it is now. You want to start?
Sure.
Matt?
I mean, so I think you outlined the problem well, and that's kind of where we start with is this huge system that's been built up since the early 1900s when we started doing health insurance, which in the U.S., it started after the after the war and during the Depression, before the war even, where companies were offering healthcare, and that's how we started with an employment-based system. And while many other developed countries went the way of a single-payer system, they all do it slightly differently, and we can get into that in the future if we want. But we went with an employment-based system, and what we've ended up with is a system that has layers and layers of bureaucracy done by hundreds of different companies and differently in different places, and it leaves out over 50 million people at this point. And even those ones that are insured, often without realizing it, don't have insurance that actually gives them what they need. So they don't know that they don't have insurance, but they don't really, because they have these very high deductibles. They end up having to pay thousands of dollars before their insurance even kicks in. And for many of these people, their insurance is so useless that they might as well have none. And oftentimes it's actually worse than that, because for people without insurance, there are at least some systems to help them get medicines and things like that. But if they technically have insurance, they won't qualify for these systems. So some people are actually even worse off with some of the very poor insurance that's out there.
And they don't realize that until they're in
Until
a
they get
crisis
sick.
and they're
Yeah.
sick and they need it.
Mm-hmm.
So, Kathy, why don't you say how you feel or see the situation?
I agree with Matt, and I've also seen the number of healthcare-related bankruptcies rise exponentially over the last, with the recession in general as well. People don't have as much tucked away. They don't have as much reserve, and so when they find out they have a major health crisis like an accident or a cancer in the family, they find out what what they thought was health insurance really does cover or does not cover, and insurances can take away that coverage, called rescission or rescinding coverage, if they feel that you weren't completely honest. Maybe you forgot to let them know that you've been treated for depression in the past, and they say you lied on your application and that was faulty, and so we're going to take away your coverage before you get your chemotherapy. So I think it was about 75% of healthcare bankruptcies, those individuals had some form of health insurance that did not adequately cover them. And so that's been the biggest thing, you know, being tied to your job, a job you may or may not enjoy or be your passion, yet you know you have to provide for your family and your children, and say I want to give them health care, so I have to work for, you know, company X for the next 20 years and stick it out and give my family what they need, as opposed to being able to travel and take your health care with you and have it be portable.
Yeah, I've talked to lots of people who are stuck to their job mainly because they have that benefit. I'll come back. There was something you said, but I'll have to think about it. Bill, you're the regional organizer. You have a passion for the health care of folks.
That's
Tell
right.
us a little bit about how you see it.
That's right, Logan. I joined SPAN, which is the Single Payer Action Network Ohio, in 2005. I went to my first conference in Columbus then, and it was at that time that during the conference, we had breakout sessions in the afternoon, and I joined the faith-based group, and that's when I heard that my church's General Assembly actually endorsed the single-payer bill in
what church is that?
Congress. It's the Presbyterian Church USA. And I thought it was a little strange that I had to go to Columbus to hear it from a retired pastor instead of through my own church. But that's how some churches are, and they don't like to get political. So it's difficult sometimes, even in a local church, to help them or to get help from them at spreading the word about single payer. But I've gone to a number of conferences, and I've gone to seminars, and I've really enjoyed meeting the people that I have, the many doctors and other people that have become involved in this movement and are trying to educate people about single payer and how it's really the best solution that we have. And I've read many books, and I've collected a few DVDs, and I watched a couple good programs on Netflix last night, as a matter of fact. One was a Frontline program about healthcare, and then there was another one, Sick Around America, I think was the name of it. I don't know, but there were a couple of real good programs, and you can, you know, if you haven't seen any programs about healthcare and the ways that we believe the issues around healthcare can be solved, you need to get plugged into some of the organizations that are trying to help everybody get coverage.
Okay, one of the things that you said was the bankruptcy. One of the biggest cause, supposedly, of home foreclosures that we mentioned here in Montgomery County is health care. Health care, and it's not that the hospitals, but the insurance companies and the debt, people that end up with your debt from the hospital end up taking your homes. And I always thought it was kind of ironic. The hospitals seem to be expanding their property all around themselves, and somewhat, you know, people don't realize that some of these properties are being lost because of people's health care crisis. We were all at the SPAM conference in Columbus, and we have a little footage here of that conference. And we want to get into the whole issue of there's the Affordable Health Care Act that's starting to be implemented. There's several parts of it have already been implemented, and there's a big debate here in Ohio and around the country, all over the country, on the expansion of Medicaid and how that's going to happen, and whether it's going to happen here or not is still up in the air. But we want to show a little bit of the questioning that took place with the keynote speakers that were at the conference that relate to how to deal with, and we'll come back and talk about that. And I want to get this out there, and then we'll go into the meat of the subject, as it were. and see where we go from there. So if we could show the tape, it starts with a woman asking a question or talking about the comments that were earlier, but it's sort of a self-explanatory.
Hi, April Stoltz. Real quick, two things. I just wanted to say, Lori, thank you so much for your message. I think it's a very powerful message to be talking about allies. We've got UCAN in the room today. I mean, thrilled to have all these other groups in the room today. Thank you, Debbie. You've done incredible work at building bridges. Sister Lori was right. It's all about building these bridges, right? So thank you so much. So here's my question. My question is this. Mike, I hear what you're saying. You're talking about being ready, and you gave us some important stories. Now, this whole healthcare thing is very, oh my God, there's so many moving parts, right? There's so many layers, there's so many moving parts. So when I'm out here and I hear people talk against the Affordable Care Act, it's like if I don't know enough, I might think you are one of these folks that believes all the lies that are on the radio, right? And I know you're not, brother. So here's my question. How do we build that bridge to be able to be critical in a way that doesn't make us sound like we hate the Affordable Care Act? I mean, I always say it's the first step in the right direction. I think probably a lot of us in this room believe that. So what I want to ask is, how do we do what you're asking us to do and not sound like we're a bunch of antis? Okay, there, that's it.
I have to do a better job of speaking. A, I'm not a physician, and B, I don't support the bulk of the Affordable Care Act because of the impact. I do respect some of the intent, and I think the way, I mean, I've been framing the story of the Affordable Care Act about differentiating between the intent and the impact, and so far I've found that to be compelling. To give credit for the goodwill of the intent and discuss the impact in a way that's so compelling, people ask, what else do we need to do? Because it's not working. You know, I'm of the opinion the effects have not yet been fully felt. And when the effects are more fully felt, we're going to have a group of people who are disappointment, and disappointment can be turned into anger, and anger can be turned into the ability to mobilize. Sorry for being cynical. I'm not sure that's cynical, that's being an effective organizer. Find the reason that people are passionate, give them a channel to exercise that passion, and give them a direction. And they'll do the rest on their own. So I'm sure there are different and even more effective ways to frame this story, but I try to acknowledge its success, demonstrate its impact through the stories that are indisputable, and then appeal to the person's sense of justice.
My personal position and the position of my chapter is that A, the Affordable Care Act is the law of the land. B, people want to find out and want to understand how it's going to impact them. That's the conversation that individuals as well as organizations are having. C, these individuals and organizations often don't see working on state single payer as contradictory to supporting the implementation of ACA, whereas pushing for national single payer is a more difficult conversation. People do perceive it as contradiction. And I'm, again, not saying that because of that we are not talking about or working on national single payer. We are. But in terms of how to have that conversation and get the foot in the door, we have found it very, very useful to simply acknowledge my organization may have a different assessment of the ACA than you, but let's find common ground. I mean, it's exactly how I described that meeting, right, with National Physicians Alliance, with Doctors for America, with CIR, SEIU, with all these groups. And we're honest about it. We believe in or believe. We know you may believe something differently. We know we still have a lot of common ground, and let's work on it. And in our attempts to get these groups' endorsement of the state bill, and I just told you that we have been successful, in that conversation, we often do get the answer, well, okay, I support this idea, but can you tell me a little bit more about how you're conducting the campaign? How are you talking about the ACA in this campaign? You know, are you saying things that we're going to disagree with in this campaign? Because that wouldn't be very fair, is the implication. And it's true. It's true it wouldn't be fair. So my response is the following. I tell them how we're organizing one of our town halls. As we get more and more co-sponsors in the state bill, and as I mentioned earlier, we are just 2 co-sponsors short in the New York State Assembly to pass the bill. Right? So the Senate is a much harder fight, but we have 74 in the Assembly. We just need 76. We have 75, but one had to resign due to a corruption scandal. But we're so close. We're so close, right? So. So when we're talking to these groups, so as we increase the number of co-sponsors, we still want more, of course. We are having repeated meetings with with legislators who have already signed on. And one of our demands is that they get more active, and one of the very concrete things we suggest is do a town hall in your district. We want your constituents to know you're taking leadership on healthcare. It's very important to them. And we want you to educate them, and we will help you do this town hall. So we are organizing among different things to push the bill, one such town hall in East Harlem with Assemblyman Rodriguez. And what we actually proposed to him was, we know people in your district are wondering what this federal healthcare reform law is how it's gonna affect them, and people are gonna wonder what's happening with Medicaid, Medicare, and other things. So we propose that we start with a patient story. If you can have your constituent, one of them, speak about his or her personal story, and then we propose a 20 to 25 minute. That's the biggest chunk of the town hall. We will get an expert to talk about the Affordable Care Act. And who do we invite for that? We invited someone from CMS, from the Center for Medicaid and Medicare Services, to talk about the Affordable Care Act. If our intent were to just put it in a very negative light and then come and save the day and say, well, single payer is going to solve all that, we would have invited a different person. But we knew that the audience for that particular town hall is going to be very, very, very new to this. So they just needed some answers about how it's going to affect them. Right? So it's not a positive or negative thing. It's somebody from Center for Medicaid and Medicare Services who knows the details of how it's going to some of the impact. I'm sure they will not actually end up going to the impact that you were talking about, which is also part of the ACA's impact. And then we're going to do a single payer 101. And then we're going to talk about the state bill and get some people on the bus for our lobby day coming up. All right, so I respond often by...
It gives you a sort of a flavor. It's a very successful conference, I felt, that SPAN happened. We've been going to these conferences. And initially, it was before, the single-payer health care campaign has been around for a long time as a solution. It's modeled partly on the Canadian healthcare system, where they set it up back, I think, in the early 70s. Mm-hmm. And to explain how it works, it basically replaces all the private insurance companies with one large self-paid insurance set up by the United States government or by the state. We have a bill here in Ohio that would set it up here in Ohio. It's funded through a number of different taxes that are non-taxes, but it would cover everybody. It would cover nearly all major medical and dental and all the major medical issues, mental health. And it does away with the middleman. And one of the speeches I gave on healthcare, I called the health insurance companies like piranhas. And one of their agents came up and was very unhappy that I called them piranhas. But they're basically, they used to be nonprofits. Mm-hmm. They used to be not out for the money, and it used to be affordable. to some degree. It was always an issue, you know, when I started working in the factories. I got health care on my own, and it was costing me about like $37 a month. And I thought that was too much money, and being young and feeling, you know, like, well, I didn't want to pay for it. So eventually, well, I changed jobs and didn't have health care for most of my life. But it is a different system, and we have major problems with the current systems, and there's going to be major problems with the Affordable Health Care Act. Would you like to start and say how you see this dilemma that we're in and where we might go with it?
Sure. I think just to talk a little bit about what the Affordable Care Act is going to do. In terms, I like the way like Lori Wen and the other speaker talked about it, in the sense that there are definitely some good steps. We all, I think, here support Medicaid expansion and trying to get more people covered, but it's going to leave a lot of people still not covered, and that is one of the big things that we're worried about, and also making sure that the insurance that people get, if we do get Medicaid expansion, or if we don't, the insurance that people can get through the exchanges, that it actually is covering the things that need to be covered, is another big battle that still needs to be fought, and that's going to be being fought. And I think that it's an important thing to keep an eye on. I know right now in Ohio, we're still fighting that first fight, which is trying to expand Medicaid right now, and the state legislature is putting up a big fight on that, and it's kind of changing day by day right now. But hopefully that's still something that could happen, although depending on the day it looks worse or better for that at the moment. I think that they alluded a little bit to this, in that for SPAN Ohio, which we're a part of as well, we're looking at doing single payer on a state-by-state basis, because although ideally I would love to have a national single payer plan, I think that it's much more realistic to look at this as a state-by-state thing, and there's states like Vermont that have actually managed to pass what amounts to a single payer system that they're hoping to implement soon. And I think that if we can do that state by state, it's actually looking a lot along the lines of the Canadian system that you were talking about, because Canada actually started their single payer system in Saskatchewan as a provincial program that then spread to the other provinces very quickly after that, because they realized the benefits of having a single payer system with much better health outcomes for about half the price, and covering everyone. So it's important things.
So Kathy,
I think what I didn't realize, and a lot of people didn't realize until the Affordable Care Act, or Obamacare, started, was that the Obamacare is actually going to bring down private insurances to the point where they have to spend 80% of their dollars on actual patient care. Up to this point, they haven't even been spending 80% of that money. So 20, 25, 30% of the money they take in is purely going to profits, to non-administrative costs, to non-patient care costs. And Medicare services, they are at about a 3% overhead, whereas the private insurances are upwards of 25 to 30%. And even Obamacare is only bringing them down to a 20% overhead, whereas single payer, as we see with Medicare type system, can directly taking your tax dollars and giving it straight back to you in terms of health care needs and actual coverage, significantly decreases the overhead cost and is much more efficient. And I agree with Matt that at this point it may be a state-by-state system around, because state rights and state ability to set things up for their own populations can be an important and powerful tool. Whereas Canada did it, and they still have individual provinces have different systems that carry over from province to province, though. So you have your basic standard level of care that everybody has across the country, but then province or state by state, you can have slight differences in that. You can always a state can always allow more, or an individual can pay more for more services that aren't necessarily a basic of care for an individual.
So Bill, why don't you say how you
Well,
feel?
I think one thing that we've failed to mention so far is that the Affordable Care Act had a provision in it that was taken out, much to the dismay of many, and that was known as the public option, and that would be a less expensive public insurance that could be purchased in lieu of finding a plan that's on the commercial market. And one of the things that you mentioned earlier was the effect of medical bills on bankruptcies. The bankruptcy rate in over 60% of the bankruptcies that have been filed in a study, they found that they were due to medical bills. And what's more significant is that more than 75% of those 60% of bankruptcies were people that had insurance. So clearly, insurance is not the answer. People have, they go out and buy insurance they can afford, and a lot of times that's really not something that's going to cover them to the degree that they need. They only find out after they've been in an accident, or at maybe on an athletic field they get injured, or somebody runs a red light and hits them. They find out how inadequate that insurance is.
Well, that reminds me of a point that I was going to make earlier, that the insurance companies have overseers that sit in a room 24/7, and they have different people come in, and when someone's in the hospital in the middle of a crisis, they call in about their insurance to see if they're covered for either that accident or that disease, what they're going to pay, and they basically play God. I mean, they have certainly a script that they go by, or bylaws, or a contract that people have signed, and these people are making these decisions instead of the doctors or the patient. It is the insurance companies that are making the decision on whether not whether you're going to get the service, but whether they're going to pay for it, which makes a lot of difference. We talked about people dying prematurely because of our healthcare system, and one of the stories I read was a fellow from Greenville, Ohio here, was sick. You know how people are, they're tough, they don't want to go to the doctors, they're going to weather through this, and it turned out he had pneumonia, he didn't know it, he went to the doctor too late and died prematurely in his 20s.
I think everyone has the fear that insurance is going to get between them and their doctor, whether it be the private insurance company, or as people use the scare tactic of the government, Obamacare getting between you and your doctor. And you have to kind of define what that means. And yes, I think the problem we have with private insurers and them taking 25% of what you pay them in premiums and not using it towards your health care is that they have a for-profit, private enterprise, free market type mentality, and there's nothing wrong with the free market except when it comes to your health care. And I don't think the free market should be involved in your health care, and making profits shouldn't be the primary goal of your insurance company. And so when you take out the private enterprise profit-making aspect of health care and you say, yes, there has to be some oversight to say, well, you want this test, but there's no evidence that that's actually a appropriate test in this situation. Sometimes there's an appropriate aspect to say, well, that's not really evidence-based care, versus that we're just not going to pay for that because you said you didn't tell us you had eczema 5 years ago and we're treated for it, so we're just going to not pay for anything. So you have to kind of separate those things out. That I think our current system is free enterprise, make a profit off of people being sick, you know, to collect their premiums until they have breast cancer, and then say, oops, you know, you didn't tell us about X, so we can't, you know, you don't have coverage anymore. And that's what we need to get away from, and we need to get the profit-based mindset out of it.
And I like your point, Logan. The question of how people use healthcare, and if you don't have insurance, and this has been shown in study after study, people don't go to the doctor. Like you said, I mean, even if that person thought that, oh, you know, I have pneumonia, I should probably see the doctor, if they don't have insurance, they're very likely not to, because they know it's going to cost them too much money, and they don't know the resources that they might have or might even not have. It's hard to say. But if that's one of the things with a single payer system, is that everyone has insurance, that they can take it anywhere, they can choose whatever doctor they want, they can go to whatever hospital they want, and they're able to use that insurance so that when they have hypertension, or high blood pressure when they're 30 years old, they go and they get that taken care of, rather than waiting until they're 60 and they have their first heart attack because they've never taken care of their high blood pressure.
If they make it to 60.
Well, yeah, very good. I was being optimistic. But you know, the point is that they can get it's very inexpensive to treat hypertension as long as you're treating it earlier and you're treating it well. It's very expensive to do a bypass surgery on a patient who hasn't treated that with a $4 medicine they could have been treating with it for the last 10 years.
That's, from our point of view, or my point of view, is that one of the shortcomings on the Affordable Health Care Act is going to be, to what extent is it really going to be doing preventable
Preventative
early medicine for people. Now, we're going to break this down. We have 50 million Americans that have no health insurance as of now. Under the Affordable Health Care Act, which goes into effect on January the 1st, 2014, this coming January, we have a number of states who've already agreed to expand Medicaid, and then there's a whole slew of them that have not. And there seems to be a lot of pressure from a lot of the Republicans and conservatives in these states to implement. They want to do a managed care system, or put it into the exchange or into private insurance versus given the direct Medicaid service. Then part of employers are mandated to provide health care to some of their employees. One of the phenomenons that we're seeing a lot is part-time employment. We already have 30 million Americans working part-time. We talked about that a little earlier, but so we have 30 million Americans who are working part-time, and places are either not hiring full-time or actually pushing people into part-time to avoid having them to be in the pool that they're going to have to pay for health insurance. They also, a lot of companies are looking at, instead of buying health insurance, paying the penalty. There's a penalty that the companies are going to have to pay for not providing health care for full-time employees. And that's a lot cheaper than paying for health care. The other thing is the individual is mandated to buy health insurance. And we have 50 million of people who can't afford it now, most of them. And how are they going to afford, the ones that aren't going to be covered by their employee, how are they going to afford health insurance? You have a $95 fine if you don't get health insurance. Now, how they're going to, whether they're going to take that out of your income tax return, or how they're going to bring you up in front of your driver's license, or how they're going to fine people $95 for not having health insurance. So that's an overview of what's supposed to happen in January.
Just To clarify one thing, actually, so Obamacare actually, what happens in January is that the Medicaid expansion goes into effect, hopefully, and the state exchanges start. There have been a lot of parts of Obamacare that have been in effect for the last couple of years. So it really technically went into effect 2 years ago, but now we're going to see the more tangible evidence of it. So you do see some things. So things like you're talking about some preventative care stuff that's now covered. So like colonoscopies, well-child visits, mammograms have to be covered with no copay. Kids can't have a lifetime cap on benefits. They can't, pre-existing conditions for children can't be there, although for adults they still can until the beginning of 2014. So there are some things that have gone into effect. The problem we're going to run into, especially with the whole Medicaid expansion thing, is that the way the system was set up is that, so people, the fine that you bring up, people that are make under a certain amount of money won't have to pay the fine, but they're going to run into the problem that if we don't have Medicaid there, they're not going to fit into the exchanges because they'll make less than 100% of the federal poverty level, which is where the subsidies start for the exchanges. And then they go up from there to make it so that it can be affordable for people. But there's going to be a big group of people that are going to have a lot of problems if we don't expand the Medicaid, because it's anybody under 100% of the federal poverty level.
Yeah. Including a lot of healthcare providers, because they won't be getting paid.
Well, yeah, that's...
And technically the subsidies are going to go from 100% all the way up to 400% of the poverty level for subsidies before you start being penalized. But those, yes, without Medicaid expansion, those people over 138% or under 138% and under 100% of the poverty level, those vouchers are not going to be enough to allow them to buy on the exchanges without Medicaid expansion.
So this is all coming down, and you know, presumably, you know, in some states it's going to just fall together. It's going to work. I've talked to people in Massachusetts of both opinions. People who thought it was just absolutely great. This affordable health care plan is partly modeled on the Massachusetts model that Romney put into effect. There are people there, poor people especially, who think it's just great. They've gotten medical coverage and that things. And then I've talked to people who were self-employed, who are being penalized and actually going to court because they can't afford it, because they don't make enough money, and so there's a group of people that have fallen through the cracks there.
Yeah, there's still that issue with Romney Care in Massachusetts is going to be mirrored across the country with lack of insurance. I mean, people aren't going to qualify. The thing that we need is universal care. That's everybody's covered. And that has failed to materialize in Massachusetts. And they did do better at the beginning, but as time went on and you know, prices continued to rise and subsidies didn't, less coverage was being purchased, so fewer people were covered. And we anticipate the same thing to happen with Obamacare across the country.
And I think you have to realize, as you pointed out, that Obamacare is a conservative plan. I mean, it's modeled after Romney Care. It's the whole idea of a penalty for not having health insurance. All of this stuff was started on the right in this country, and so a lot of this is actually a very conservative plan that, interestingly, has been attacked by the right, even though it's their own plan.
Now, one of the things the right did is during the elections, they were attacking the cuts. One of the things that's going to happen is there are going to be cuts to providers to help pay for certain aspects. One of the things that came up in the conference is how are they going to pay for Medicaid expansion? And one of the ways they're going to do it is they're going to cut the subsidies for the uninsured to the hospitals. And I'm wondering, if they don't do an expansion, are they going to cut the subsidies to the hospitals or not?
That one, I don't know as much about the particulars of that. I do know that one of the things, and the reason why, interestingly, in Ohio, the coalition that is fighting for Medicaid expansion is a very wide-ranging group. It's everybody from the Chamber of Commerce to Planned Parenthood to the Ohio Right to Life. It's the hospital associations. It's everybody.
Yeah.
Because there are, and the hospitals come up because the hospitals right now have what's called the Hospital Care Assistance Program here in Ohio, where they get money for people who are uninsured and who can't pay. And I know that's through the state. I know there are federal programs for that sort of thing as well. But that's part of what Medicaid expansion would do, would be able to allow these hospitals to cover for their uncompensated care that they get, and the state wouldn't have to pay as much through the Hospital Care Assistance Program anymore.
Right.
So this is one of the many reasons why Medicaid expansion is it's a money saver. It's a no-brainer for the state, really.
We should point out that the first 3 years of Medicaid expansion are 100% funded by the federal government. We're throwing away something like $13 billion of federal funds. We're already paying this tax to the federal government, but we're not going to take it back to help expand Medicaid for the next 3 years through 2016, at which point that federal assistance drops by only 10%, and we'll still be getting 90% assistance from the federal government. Again, that's all our tax dollars that we're already paying to the federal government that we should be giving back to Ohio to help cover our most needy population.
Well, I fully, the Full Employment Council, which is the group we work with, fully supports Medicaid expansion. Though we're very skeptical of both its implementation, even if it is passed, and the fact that it only goes to 138% of the poverty line, which is fairly low. It leaves, but as you say, the gap starts there. It's sort of like, I don't know if the audience or people are familiar with the donut hole in the drug bill. There's the people that, they have their expensive drugs paid for up to a point, and then they fall into, after they've used up so much of that money, they're in the donut hole. They don't have any more income. And the whole thing is a huge ball of wax. We have two very big phenomena going on. The economy is extremely sluggish at best. We are in a 5-6 year recession that's the worst since the Great Depression. We're still involved in wars in the Middle East and in now Africa, which is draining billions and billions of dollars out of the budget. They never talk about that. Where they talk about saving money is the fact that we've really spent trillions of dollars in the Middle East and Africa, and we have won very few friends there doing that. So we have both of those phenomenons, and then we have the Affordable Health Care Act, or Obamacare, which a lot of the people in our audience are supportive of, and there are certain aspects of it, like the Medicaid expansion, but it's thrown on top of a medical system that the cost the system, and a lot of people will blame the doctors or the specialists, but it's really the equipment, everything combined, and the insurance companies.
There was a great article that just came out, and I think it was Newsweek, I can't remember, that looked at the healthcare system in this country and the underlying the cost, where all this money is going. And you're right. And
I think it was Time.
Or maybe it was Time, I can't remember. But anyway, they looked at it, and I mean the cost that the hospitals and how much they bill, and the drug companies and how much they charge for medicines. And I mean, there is an insane drain of money that nobody even looks at. And you're right, it's putting a Band-Aid over a very damaged system.
Yes, and most people do. Medicare is a very efficient system. When they brought in the Part D, though, that's the private part of Medicare that people hate and is horribly inefficient. And that's where you have the donut hole for medication coverage, where the federal government was restricted from negotiating with the drug companies over price of medications, so that they are locked into whatever the drug company wants to charge the federal government for these ridiculously expensive brand name drugs, and pass on to our elderly and our disabled as well. And so, expanding Medicare so it's more comprehensive and eliminates that waste of the private sector that's just taking profits off the top without negotiating costs would make it a much more comprehensive system for everybody.
Yeah, Medicare Part D was a gift to the pharmaceutical companies, and now along comes Obamacare, and that's a gift to the insurance industry.
See, now the right, the conservatives say that Obamacare is socialized medicine. And it's not, you know, outside of Medicaid expansion, which is government-ran health care for some people, small part of these people. But overall, it's for the health insurance companies are all left intact,
Yes.
and it becomes mandatory to be part of the private system.
The grand majority of the expansion of healthcare in the Affordable Care Act is from private insurance, and even the Medicaid expansion. If you look at the state like Ohio, almost all of our Medicaid is run by private companies through the state government, but run by private companies.
Yes.
Yeah.
So it's been privatized, but it's still public.
Yeah, so they
So-
take a cut off the top before they give you the healthcare.
So they're not piranhas, they're
They're entrepreneurs.
entrepreneurs.
They're entrepreneurs.
Well, you know, we all know each other, and you're a part of SPAM, which says that the single-payer healthcare system is a lot more logical and humane way of providing healthcare, which I think we all believe is a human right. That the problem
Absolutely.
with the way it's set up now is people are being denied that, and we are the most advanced, the richest country in the history of the planet, and yet we have people dying prematurely and people out on the, you know, and the other thing that strikes me, you know, we work with poor people, and our group, our advocacy is 50 million people are uninsured, and now 50 million people are living below the poverty line. And the two figures just happen to coincide with each other as no accident. We envision a lot of confusion out here, and what we believe is that there has to be sort of a grassroots education and protest against this. There's amazing, there was a protest in Lima, Ohio, which we don't see protests in these small towns about Medicaid expansion. And there's a lot of groups and people who have bought in at the grassroots, not just the hospitals or the chamber, but there's a lot of people that are being educated about this, and the fight for whether the part that's the best part of the affordable health care is even going to happen. And so we encourage everybody out there to get involved. You have, put Bill's phone number back up here, get in touch with Bill.
Yeah, I've also got a couple books here. There's a book called 10 Excellent Reasons for a National Health Plan, and you can get these at the you can get these at the library, or I ordered this one and a few others from Amazon. They were selling them used for a penny, and I think I paid, you know, less than $5 for shipping. So it's a good investment if you can't find one at the library. Now I also have a DVD. Yeah, this is this is called The Healthcare Movie, and it's a couple years old now, but every American should see this DVD. There's so much misinformation out there about the Canadian healthcare system, and this will help dispel some of the myths and show you how a country like ours could be doing so much better for its residents.
So one of the promising things is there's a lot of doctors and people in the medical profession that are involved in single-payer Ohio here. The unions are a very strong supporter around the country. I think they need to be stronger supporters here in Ohio, but and they have been. We've had a number of unions that have been involved at the state level, but around the country, I don't know if you see the labor for single-payer information. The unions wanted to get health care off the bargaining table, and the affordable health care does not do that. It's still very much the bargaining issue for people's contracts.
Yeah.
And unfortunately, it's just the living standard is going backwards. The people's
I cannot imagine myself being an employer and having to deal with an insurance company every year and having to print out and distribute all the material that you'd have to give to your employees every year. And people talk about freedom of choice, and if you're getting your insurance through an employer, you're really not, you don't have a choice. The choice is being made for you by your employer.
And actually, if you want to see, SPAN Ohio has a website. It's www.spanohio.org that has a list of all the unions and many other people, doctors, many organizations and businesses that support single payer in Ohio, and it's quite a long list. It's very extensive.
And Physicians for a National Health Plan, pnhp.org, also is a good source of information.
Now we got, a couple years back, we got the city of Dayton to endorse single payer health care. Though I think they have forgotten about it, and we need to go down there and remind them that they're supporting it. And to get the city and the community mobilized is a challenge that we're going to be working on with Bill and you guys, and want to be a part of that. We sort of stepped back to work on other issues here, but we're definitely at this last conference, Tim Bruce, who's one of our co-producers here, and myself really feel like it's dear to our hearts that healthcare is an amazing part of people's lives, and they need to take responsibility and get out there and kick some butt. We really appreciate you guys coming out tonight. And
Thanks for having us.
Thanks for having us, Logan.
And keep up the good work. And as we always say, that it's the community, it's your life, it's your health, your family, and that you can have an impact. And to become part of the impact of our society, we need people to stand up and start getting involved in the healthcare issue, the unemployment issue, the poverty issue, the crime issue of our society, because these are all interlinked, and we need to work on it together and solve these problems in our lifetime and not wait for the politicians to step to the plate, because they just push us back.
Do you suppose it has anything to do with ownership of Congress by the corporations?
Well, certainly some of them. So thanks for turning in, and look up those websites, Single Payer of Ohio.
www.spanohio.org.
Yep.
Say it again. Oh,
So.
thanks for coming.